All right. Hello, everyone. I'm your host, Aileen Mapletop, and welcome to MTAS's Knowledge Transfer webinar series. And the purpose of these webinars is to promote and advance evidence-based practice and research literacy and capacity among our membership through high-quality knowledge transfer activities. So knowledge transfer, what is that? What does it even mean? Is it even useful? Well, knowledge transfer is just that, the transfer of knowledge, often from one person, one team, one organization to another. And the knowledge is information that exists in your mind, in an individual's mind. And this can be difficult to translate into words or visualizations. And as such, knowledge transfer can be imperfect. And remember that time when your patient told you of your chronic hip pain, or that according to their GP, it was due to osteoarthritis and nothing could be done about it. You then quickly rush out and consult Dr. Google, and out pop several research articles relating to osteoarthritis and massage therapy. You hastily scan one of those papers. Okay, according to the research paper title, it looks like massage can help patients with OA. That's great, but that's all you understand. The other parts of the research paper throw numbers and figures and science at you, stuff that's hard to decipher on paper, let alone trying to take that information and applying it to real life. And there's 5 more papers you have to sort through. Deep pressure, light pressure, what's the physiological explanation? Does massage even help with pain? And unfortunately, you're nowhere close to finding out the answer. Does that sound familiar to everyone? Well, that was the problem that I encountered several years ago in my massage therapy practice. Eventually, I found out there were other forms of knowledge transfer that were way more engaging and easier to consume, like this webinar interview that you're about to hear. We reached out to 2 well-informed thought leaders in the field of massage therapy. We have Dr. Donelda Gowan and Eric Purves to record and share an intelligent conversation about massage therapy and the clinical management of pain. So before we get started into it, I want to introduce you to those speakers. Dr. Donelda Gowan is the Associate Director of the Center for Integrative Medicine in the Department of Community Health and Epidemiology, College of Medicine at the University of Saskatchewan, where she holds an adjunct professor appointment. Her main research interests include massage therapy, pain, integrative medicine, and knowledge translation and transfer. Eric Purves is a registered massage therapist, educator, and healthcare researcher based in Victoria, BC. He holds a Master's of Rehabilitation Science from the University of BC and currently instructs pain management, rehabilitation principles, and evidence-based practice strategies for manual and movement therapists across Canada and the US. So here's Dr. Donelda Gowan interviewing Eric Purves as a follow-up to his chronic pain management workshop that was held in Saskatoon a couple months ago.
Hi, Eric. How are you doing?
I'm good, Donelda. How are you today?
I am very well, thank you. And thank you so very much for agreeing to this follow-up conversation with me. We've had an opportunity to chat a little bit, emails and texts, and I was so delighted to be in the audience for your course here in Saskatoon. And so thank you for providing opportunity to record a follow-up interview. I've spoken to others who weren't able to attend your course in Saskatoon, and they were quite excited about the fact that we were going to have a conversation to follow up. So thank you very much for agreeing to do that. I'm really grateful.
Oh, well, thank you. Thanks to you and MTAS for having me. I really enjoyed the opportunity, and it was a fun weekend, and it was a good group of engaged therapists there that hopefully learned a little bit of something anyway.
Yeah, great. Thanks. It was fun. I really enjoyed my time too. Okay, well, listen, we just have a short amount of time today, but short and sweet, and some really, great opportunity just to touch base on a couple of things. I wonder if maybe I could ask you if we could discuss 3 things. I'd like to talk about just a little bit of some of my learning highlights from the course that I found really thrilling and exciting. And I wondered if we could just talk a little bit about that. And then also, I know that you recently completed your master's degree, and I wonder if we could talk a little bit about that. It's something that ties into our conversation in terms of knowledge transfer and continued learning. And so I'm going to ask you a little bit about that as well. And the last thing in our little brief discussion here, I'd like to talk about other knowledge transfer opportunities and resources. If we could provide a little bit of encouragement and information for our colleagues and our peers about some of our opportunities and some of our history of engagement with pain science, with research, with conferences, with other individuals, I think people might find that really valuable. So may I tell you my #1 highlight from your course in Saskatoon?
Please, I'd love to hear it.
Okay, your #1 highlight for me was just the simple and elegant way that you said, listen, pain by definition is unpleasant. So there really is no good pain, that we simply lack the language to describe our experiences. And that was really profound to me. So you know that the topic of my doctoral dissertation was adverse events in massage therapy. And so you and I've been joking a little bit with you that I wish I'd had that conversation with you several years ago as I was trying to find the language to describe the experience of adverse events in massage therapy. And just your simple way of communicating that was really helpful. So can we talk a little bit about pain science and talk about pain, what you have taken away from that statement?
Yeah, I think language, it seems to be a big thing in terms of understanding and describing the human experience regarding pain. I think the whole concept of the science of pain is it's such a huge area. It can be very daunting to try to understand what all the science around pain means, and interpreting all the research can be very difficult. I think for me, when I went on this journey, I think really what the things that really resonated with me was understanding that, like you said, pain is unpleasant, but the nature of our treatments, we're often taught to think that pain is a necessary part of healing or a necessary part of recovery. And I think that what we have to realize is that when we understand that pain, and particularly persistent pain, is really overall human experience that involves sensitization of their entire person and of the sensitivities of the nervous system, that all of our treatment interactions should really be to try to calm the system down, calm the nervous system down, make the person feel less fear and more comfortable. And when you take that approach about trying to make the person just feel better, I think it completely influences our entire treatment interaction, that makes, I think, has a greater likelihood of the person moving past their current situation and getting better.
I like the way that you've articulated that, and isn't it fascinating? Well, I find it fascinating. I wonder if you do too, how we in this field perhaps are coming full circle. We have this amazing complexity in science, we have this amazing complexity in physiology and pathophysiology and the neurological components, and you teach a lot about the biopsychosocial framework, and we're coming around full circle to our hunger, our thirst for understanding that complexity and our role in the very simple, very challenging project of making people feel better.
I like that.
So I'm grateful for your input, and I have I have many things, I have many highlights, but I love the way you articulated that simplicity. So
I think, sorry, just to jump in for a second. I think the biggest thing I think that's most important about what we do, or any person treating people with musculoskeletal pain, is I think too many of us make it too difficult. And I think the more simple we make it, I think it's simple solutions for complex problems is kind of the right mindset to come in.
I like that. Simple solutions for complex problems. And I would say in my career, in my time in the field, I think that we are just at an interesting place right now where we really are starting to respect the complexity of the problem.
Yes.
Yes. And I think that's where we're going to make our greatest advancements, is where we have a respect for the complexity of the problem. I also think that massage therapy is a complex intervention. I don't know if what your thoughts are in that regard and how you work that into your own research, but clearly to me, massage therapy is a complex intervention for complex problems, but the role of the massage therapist and how we approach that, we need to work out a simple road towards success.
That's very well said. I think any human interaction that we have, is going to engage the whole biopsychosocial framework of the person. And so our interactions are very complex because there's hands-on, there's communication, there's our words we use, there's the advice we give, it's how we interact and how we react to what people are saying, and then their own beliefs and barriers and facilitators for their reasons for them getting better or not. It's very complex, but I think we don't need to make us in that interaction too complex. I think sometimes just being there and listening and being a good human,
right,
and just really being supportive of the person is, I think that's the most important thing you can do.
Yeah, and one of the ways that you do that, and this is another highlight for me from your two-day course in Saskatoon, one of the ways you accomplish that goal is through motivational interviewing.
I agree, and that's confirms my bias.
Right, and so I want to tell you that I wasn't the only. I spoke with other participants of that workshop, that the motivational interviewing piece was dynamite.
Well, that's good. I'm really happy. It's something that I think is extremely important, and I think it changes how we listen and how we interact and communicate with patients. And there's a lot of research that supports that as being a very, very beneficial component. So I think I'm happy to hear that there was positive feedback regarding that.
Yeah, and it was really valuable to have that, to have you as a resource for that. I certainly know a handful of physicians here in Saskatoon that use motivational interviewing and have made that their, a very integral part of their own provision of care for people. So that was a terrific resource for us. Hey, I want to tell you one other highlight, and then there's some other things that I want to discuss just in our short time here, because it sort of relates to both of those things: the complexity with which the pain experience plays out for people in their lives, and the complexity with which another healthcare provider might try to help, and that whole idea about motivational interviewing, about really trying to listen to people and figure out how can we help, what is it that individuals need within the understanding of the framework of pain that you so clearly teach. And that other highlight for me was this idea about a need for defensible treatment mechanisms. And then, of course, there was that great thing you talked about, neurotags and dismantling neurotags. So that's another neat spot for us as massage therapists in this field, is our ongoing struggle to create some theory and hypotheses and some verifiable, testable ideas around defensible treatment mechanisms. Do you want to talk a little bit about that?
Yeah, I'll try and keep that short. I think, yeah, the mechanisms of what we do and why things work or don't work, I think is really, really important, particularly so say from a research perspective, because if we understand the mechanisms better, then we can try to research them and test them. But I think, there's so many claims that are kind of like these faith-based claims about the mechanisms that are kind of ingrained in the culture of our profession, which I think sometimes, and for some individuals, those can be harmful because they create this sense of weakness or the sense of problem in the person, when we're making claims about their pain being from a specific connective tissue or for some specific pathoanatomical problem or structural problem. And if we base our treatment mechanisms on these things, what we're really taking into that treatment is we're taking the role of us being a fixer, as we are the one that can fix your problem because we're the one that can correct that broken piece of you, and we're taking a mechanistic approach to a person, and people aren't mechanisms of like, we're not cars, we're not machines, we're these very complex biological organisms. And so when we take these tissue-based approaches, I think that those mechanisms aren't defensible because there's not good research to support them. And I think that it puts the wrong focus on the individual. And I think a lot of times that can result in dependencies or things that really inhibit someone's ability to move forward because they're constantly looking for someone to correct that problem. And that's where I see the mechanistic approach as being just not helpful for a lot of people.
Not helpful and potentially facilitating people remaining stuck.
Exactly. Yeah, it facilitates a disability or that sense of problem. And I think that, some of the research that I've read, it looks, if you ask people who have, say, things like persistent back pain, and you ask them, well, what do you think is wrong with you? Or why do you think you're not better? The reasons they give are usually pathoanatomical in nature that were given to them by a well-meaning healthcare provider that just kind of has taken a mechanistic approach that isn't helpful.
Right. Well, I'll tell you, you and I have spoken about some of our experiences with our own research, with listening to other researchers speak about pain. And I wonder, I'm thinking that our peers and our colleagues would be very interested to be part of this conversation. So when I hear you say that about where we can be helpful and where we really have to take some responsibility for the fact that our knowledge, our knowledge transfer, our knowledge translation really needs to be accurate and it needs to be up to date, because when we're dealing with people with persistent pain, it is just so critical that we be on board with the current model of understanding persistent pain. And so when I talk about our colleagues and peers would be interested in knowing, some of the other KT resources. So there's others that I have learned from the World Congress on Pain in Boston. The Massage Therapists Association of Saskatchewan supported my involvement in that. We did we created some resources for our members, and that's on our website. And all of the researchers there, and in that, I've told you about this conference. There was thousands of researchers there from around the globe, and they're all saying the same thing that you're saying, is that this is the time where we have to have great curiosity about pain and about how we can help, and we really need to be willing to let go of outdated ideas that are not serving our people with persistent pain.
Yeah, I agree. I think science is always changing, right? So research is always changing. So what maybe 10, 15 years ago we thought was best practice, maybe now it's not. And it's okay to let that go because things are supposed to change. And I think that's being aware that you don't know everything and that your ideas and the research are going to change continuously throughout your career as a professional or researcher, whatever it is you do for a living, I think is super important, because if you're still holding on to the same ideas you did a decade ago, you're not doing yourself or your patients any favors.
Yeah, yeah, and it's true for all healthcare professions. So some of the resources that I want to let our colleagues and peers know about that MTAS has been really in the forefront in Saskatchewan and in Canada in getting involved with. So we have some relationship with the Canadian Pain Society in terms of attending conferences. I've presented research at some of the annual research meetings, and that was just really fantastic because there's massage therapists at the table at national conferences and national organizations where we get to be considered. Hey, what about massage therapy? And the other researchers and from all healthcare fields become quite curious about, well, where is the role for massage therapists? So Canadian Pain Society, I want to just let our colleagues and peers know about that. Here in Saskatoon, the Center for Integrative Medicine, we have lots of integrative medicine or integrative healthcare seminars, and we've had speakers around pain. I mentioned the World Congress. I wonder, have you ever done any work with Neil Pearson or Shelley Prosko, Eric, around yoga therapy and pain science?
I have met them both. I saw Neil present at the San Diego Pain Summit
Great.
5 years ago.
Yeah.
And I think that, for me personally, that is one of the best resources I can recommend for any massage therapist, is the San Diego Pain Summit. It's in February every year. It's a great conference that focuses specifically on the role of clinically applying principles of pain science for manual and movement therapists. So it fits totally well with massage therapists. But yeah, I've met Shelley there too. Shelley presents there, or Shelley's been there every year, and I think she's presenting in 2020.
She's from Saskatchewan.
Yes, I know. Yeah, she's very proud of that too. So she should be. So I have not taken any courses from them. I've seen Neil speak, but I'm familiar with their work, and I think the whole principle of movement and slow and meaningful movement and exercise that yoga consists of, I think is fantastic for people that hurt.
Yeah. Well, I've not been to the San Diego Pain Summit, and you've spoken about it with me, and I definitely have it on the radar for future, because I know they've had some, just outstanding and out of this world speakers when I've seen the lineup. So thanks for sharing with us about that, because what I really want to impress upon others, because you and I both have a great excitement about interprofessional engagement, about interdisciplinary learning, and the fact that pain is a tremendous platform for massage therapy. I have had just the most positive experiences with other scientists, with other researchers, with other clinicians at conferences, and I know you have too. And so I wonder if you don't mind if we just have a couple of minutes. I really would like to hear a little bit more about your graduate school experience and your master's degree, and what's next steps for you.
Yeah, I'm very happy I'm done. I know when I was in Saskatoon, I was kind of just at the middle of the burnout stage, because I had just finished. So I may have been rather I may not have been as positive about it as I should have been, but I loved my graduate degree, and now it's been a couple months since I think I finished in March, end of March. So it's been a few months since I finished, and the whole experience for me was overall was quite amazing. I learned a ton, way more than I expected to. I feel like my ability to research and critique and write in an academic way has jumped to completely different levels from where they were before. My whole schooling, I really focused on basically trying to research everything I could to find out the roles of registered massage therapists in the delivery of care regarding persistent pain or musculoskeletal conditions. And what I did find was there's very little massage therapy specific research, but there's lots of research out there by the physical therapy profession or other allied health professionals that really fits well within what it is that we do and fits well within our scope of practice. So there is, I think, a huge opportunity for us as a profession to be very, very important in the delivery of care that has a lot of research behind it. Right. And my final research project that I did is I basically looked at the use of evidence-based or research-informed practice for RMTs. And it was a qualitative study where we looked at kind of some of the barriers and facilitators for why RMTs do or do not use research in their practice. And it was, as far as I could tell, it was the specific questions I asked, it was the only one that had been really done that way for our profession. But it was interesting because really the results that we found, which are, I mean, wasn't a large study, so it can't be, can't extrapolate that data to the whole profession, but it was interesting that really the same reasons why we don't use research as much as we should is consistent with other professions, and that it's just really becomes a matter of that lack of education or knowledge or understanding about research literacy. But the RMTs that we collected data from, all of them admitted that they really wish they had a better foundational knowledge of research literacy in evidence-based practice kind of principles in their schooling.
Right.
And I think, you know, that's gives us something that for whoever develops curriculums to look at putting some of that into our education.
Right.
Make a big difference.
Well, and I can tell you from Saskatchewan, that is also what we found here. The topic of my master's work was research utilization and evidence-based practice among Saskatchewan massage therapists. And so that was published in 2010. It'd be really interesting to see now in 2019 how that has changed. So it's a topic that's of tremendous interest to me as well. Hey, I wanted to
say that your master's, that master's paper that you did was the one that I kind of provided my interest of forming my master's question, because I wanted to kind of explore a bit more in a different way the questions you asked. So I want to thank you again. on an online forum that your paper, when I read that, totally inspired me.
Oh, well, that's terrific. Well, and kind of you to say, and really our all of our colleagues and peers, you know, we need to know that that is part of the process of research, is that we ask a question, we seek an answer, the next researcher looks at that and says, oh, that's interesting. I'd like to ask either a different question, or I'd like to attempt to answer that same question in a different way. And it feeds into and provides fodder for the body of knowledge. So thank you for your work. Hey, and you know, when you talk about very little research specific to massage therapy, would you agree that when we say that, we really mean in relation to the quantity and quality of research from other fields?
I think yes. I think
Okay.
compared to other fields, I said there is a lot of massage therapy research,
Right,
obviously, but I think comparatively it is much smaller. We
right,
don't have the same number of academic journals as physical
right.
therapists or chiropractors or nurses, for example.
100% agree. And the reason that I pick up on that, of course, is that I do often, we have over the last few years, I often hear the lament from people that there's very little massage therapy research. And I just want you and I to be accurate and careful in what we say, that we mean
For sure.
in relation to the vast quantity of research from other fields. That does not excuse us from not being research literate and familiar with the body of research that does exist. There is some important research that we should all be aware of. You would agree?
Yes, I agree. I guess I should have qualified that. I think I think it's encouraging now compared to say 5, 6, 7 years ago, at least from when I was starting to pay more attention to stuff, is that I am seeing a lot more and meeting a lot more RMTs that are pursuing graduate education and are doing research, and I think that is very encouraging to me. And there is some interesting research coming out from colleagues in BC that I know, and I've read some of their things they did for their graduate theses and papers. And I think we're kind of at the very beginning, I think, of a very exciting ascension into a more research literate, more kind of research informed profession.
I 100% agree, and you've stated that so well. I think on this discussion, we've got some slides, and we're going to post this for our members, for our Massage Therapists Association Saskatchewan members. And I think we've got some slides with some additional resources specific to some of your work. I think we've got a link to your website, and I will certainly encourage our members, our colleagues and peers to visit that and to take every opportunity to take a course from you whenever that should happen in the future. We'd be happy to have you come back to Saskatchewan. I know that there is lots of interest in our province, so please come back and teach us again. And
yeah, I'd love to come back. Yeah.
Okay, terrific. And I want to say thank you again for your time this morning. Is there any last words that you want to share before we let you go?
Well, I really appreciate the opportunity to, like I said at the beginning, for you guys to have me there. It was really great to meet you in person, Donelda, and Lori, and everybody else at the MTAS. And I think it's exciting times for our profession, and I think that the stuff that I'm trying to teach and the stuff that I'm trying to get to the information I want to give to therapists is I'm not teaching techniques. I'm trying to give people knowledge and applications of like how to think and apply that information into their own practice rather than giving them a specific algorithm to follow. And I look forward to hopefully coming again soon to you guys. And yeah, I have been a little bit negligent of posting things on my website, but my plan for the fall is to put more blogs and maybe start doing some literature review type things on there. And so I encourage people to check that out. And if they have any questions, please contact me directly. I'm happy to talk to RMTs if they want to me direct them to resources. If they've got specific questions, I'm always available.
Okay, terrific. And I'm going to extend the same offer as well and encourage people to look at the MTAS website and certainly to peruse some of the resources there. And I'll make the same offer too. I'm always happy to talk further with our colleagues and peers about research, about pain, about the massage therapy field. And I'm always happy to talk to you, Eric, and I hope we'll connect again soon.
I hope so too.
All right, thanks. Have a great day.
You too, guys. Bye-bye.
Bye for now.
Okay, so this is all the time that we've got for today's webinar interview. We encourage you to visit the websites to find more information on the topics that we've discussed today. And again, thank you to our speakers, Dr. Donelda Gowan and Eric Purves. And a special thanks to, of course, Massage Therapists Association of Saskatchewan. Without them, this webinar would not have been possible. So I'm your host, Aileen Tran Mapletoft. We'll see you again.